Hi, Dr. Wilson. This is Jennifer Weeks. For the purpose of this assignment, my friend's name is Michael. Thank you. Hi, Michael. This is Jennifer. Just really excited that you and I can connect online, and I can really tell you about what I've learned this semester on the topic Public Health, Emergency, Preparedness, and Response. I hope all is well with you and the family, and I hope that the information I share with you today will be helpful to you and your family in the future. This slide is my introductory slide. It simply says Public Health Emergency Preparedness and Response, my name, the name of the class, and of course my school, New Mexico State University. You also get to see a picture of me here on the side and a sign for public health. Public health is all about preventing, promoting, and protecting. We want to prevent diseases and things from happening, promoting health education, health promotion, and also protecting people. What can we do to protect people? The three things I want to talk to you today about are emergency preparedness and response, the incident command system in the National Response Framework, and special populations in emergencies and disasters. These are three key topics I'll be sharing with you that I've learned a lot of information on this semester. This slide talks about this slide talks about the key areas of public health. I really like this diagram because I think it really captures what public health is all about. Starting at the top, it starts with health promotion, surveillance, monitoring, analysis, outbreaks, epidemics, disease prevention, communication, risk, and research. And of course, in the middle, we have public health. Really and truly, that's what public health is all about. The next slide, I'll be talking about the key areas individually. On this slide, I highlight that public health interventions saves lives. I am so grateful to be in this profession and to see the difference that public health makes to you and I every day and everybody else. Public health emergency preparedness and response focuses on the following during an emergency or disaster. I still have the picture at the bottom of the screen for you to see. That was the picture we talked about before, the diagram. But during an emergency or disaster, public health really focuses on surveillance. We have the Center for Disease Control and Prevention that does a phenomenal job with a lot of research, surveillance information, and providing data. Monitoring what's going on, what do we need to do different, what do we need to do next. Analysis, analyzing the situation and also developing interventions. Studying outbreaks. For example, if there's a flood situation, let's say in Africa, and there's a cholera epidemic, monitoring those outbreaks, studying those outbreaks, seeing what needs to be done with those outbreaks and epidemics. Disease prevention, communication, and risk. And risk is such a big category because it talks about risk in general, risk assessment, risk for probably contracting diseases and illnesses. So these are the main areas that public health addresses during an emergency or disaster. And then later on, when things are stabilized, we can go into the aspects of research and health promotion. But I think that immediately something happens, an event, an emergency, a disaster happens, the top tier here is what public health truly focuses on. This slide here, I have labeled Emergency Preparedness and Response. And I have actually stated the focus of and the mission of the Federal Emergency Management Agency, which is also called FEMA. Most of us know it as FEMA. And the mission of FEMA is to support our citizens and first responders to ensure that as a nation, we work together to build, sustain, and improve our capacity to prepare for, protect against, respond to, recover from, and mitigate all hazards. I know that's a mouthful, but really and truly, this is the logo for FEMA. FEMA is all about preparation and planning. And you know, this is a nice summary, I think, of preparedness, where it says get a kit, make a plan, be informed. And also planning. The way this picture really depicts a disaster scene, and right in the middle of it, plan, because once you plan, You are better prepared for unexpected situations, and you're better prepared to protect yourself and your family from disasters and unforeseen circumstances. Okay, this slide says, why prepare? Because, a lot of people would say, well, oh, you talk about preparation so much. Why is it important to prepare? According to FEMA, preparation helps us to reduce fear and anxiety, and also to reduce the impact of the disaster. If you're prepared and okay, I have my kit, I have, 3 days worth of supplies, by 3 days, hopefully somebody should come knock on my door, you're not as anxious. Not that you'll never be anxious, but you're not as anxious and afraid of a disaster. Because honestly, Michael, we can't control what happens in the next minute, the next hour. Things are unpredictable. So preparation is key. Also, in preparing, you can really do something. For example, if okay, if there's a flood, what do I need to do? I need to put this down, some sandbags down, or I need to tape up my door, board up my windows. Preparation helps. In the middle of a disaster or catastrophe, a lot of times we are so anxious and things are so chaotic, we probably don't act as we typically want to or we would overall. And so FEMA highlights that the need to prepare is real. It's not a joke, it's not a game, it must be done. I like the points that I highlight here. FEMA says that when disasters or emergency strikes, first responders may not come right away. Being prepared and having at least 3 days worth of shelter, first aid, food, sanitation, and water is important. Also being educated. Know how to respond to severe weather and other emergencies. And I just put a point at the very bottom saying prepare. I cannot emphasize that enough. Also, by preparing, you're ahead of the chaos because you've already done things when you're calm. So when you've prepared, you're good to go, rather than being confused, afraid, and not knowing what to do. The Federal Emergency Management Agency website is very detailed. I truly, truly appreciate the website. This is the website, http://www.fema.org, and FEMA is FEMA. And I just did some screenshots that shows you different categories. This is example, the planning page. It talks about being ready. It talks about, being ready, being informed, being prepared. And this website, I would advise every citizen to at least visit it once and get some good tips on preparation and handling disasters. Thanks to technology, FEMA even has an app that you can use on your iPhone or on your smartphone. Back in the day, this was not available, but now FEMA has a very good app that's beneficial for citizens as they plan. Also, if you are a disaster survivor, there's a separate section for you where you can get information, file claims, and all of that. So a quick summary about FEMA is that FEMA, again, the goal is to support for citizens and first responders. It's also national teamwork, everybody working together to build, to sustain, and to improve the way that we prepare, protect, respond, and recover from incidents and disasters. Also, FEMA really promotes all hazards mitigation. How do we prevent further disaster from happening, or how do we prevent disasters in general? One of the good things I like about the website, it says, are you ready? If you're ready, I think that's outstanding. If you're not, I really think you need to work on it. Okay, now that we've talked about FEMA and I've established the groundwork, I really want to talk about the Incident Command System and the National Response Framework. In this class this semester, I really had the opportunity to take a lot of online credits or online courses, and this is just one of my certificates. And I really like this picture in line of an incident commander, somebody that's in charge of handling all the issues, I would say, all the details, logistics, all the planning of an incident. So on this slide here, I'm going to outline and describe briefly for you the Incident Command System and the National Response Framework. Sorry that this slide seems a little full of words and letters, but at the end it'll make sense to you. The Incident Command System, or the ICS, is a standardized all hazards incident management approach. It really provides a structure for handling an incident. It is extremely useful, and this is all information from the U.S. Department of Homeland Security. The ICS is flexible and can be used for any type of incident, regardless of the scope and complexity. I think it's a one-size-fits-all kind of system. It's used by all levels of government, the federal, state, tribal, and local systems, so local levels. And then the ICS, the Incident Command System, is applicable across all disciplines. Pretty much everyone coming together, all disciplines, can utilize this system. The functional areas, there are 5 main functional areas. We have the command, operations, planning, logistics, finance, and administration. That's information about the Incident Command System. Now, the National Response Framework, or the NRF. This framework actually presents guiding principles that enables all response partners to prepare for and provide a unified national response to disasters and emergencies. From the smallest incident to the largest catastrophe, this framework provides the guidance. Again, this is also built on 5 principles: engaged partnerships, peered response, scalable, flexible, adaptable, operational capabilities, unity of effort through unified command, and readiness to act. These 2 are very important as we talk about FEMA and as we talk about emergency preparedness and response. Well, please know that I'm almost at the end of this presentation. This is slide 12, and this is another topic I'm going to be talking about, and that's special populations in emergencies and disasters. I really appreciated our discussion this semester on special populations because this can be a really challenging aspect in terms of emergencies. What do we do with a person in a wheelchair? How do we manage that person with depression or schizophrenia, a mental health disorder? How do we manage the deaf? Somebody's blind. So special populations need to be planned for in order to protect them, to save their lives, and to make sure that they are safe. Key issues with special populations that I think I need to highlight. Pre-planning is critical. We cannot plan when the incident is happening. We need to have all individuals or organizations dealing with special populations must have a plan. That's why I emphasize pre-planning. Also, following the directions of first responders. When they come and tell you what to do, just follow along. At that point, it's not key to start arguing, just follow along. Taking all important records, healthcare records. For example, if individuals need to be transferred to a different hospital, taking important information along with you so that they can continue to provide medication and the necessary. Keeping track and maintaining open lines of communication with family members, because everybody in different states will be concerned. Also, preparing members of the population for change. For example, if it's an elderly in a wheelchair, they'll be very concerned. How do we prepare them for change and letting them know they're going to be okay? Also, expect distress. There is going to be change. If it's someone with a mental health condition, someone that's deaf, blind, someone in a wheelchair, they are going to be highly concerned about their safety. So making sure that we have backup phone numbers, suicide hotline, mental health hotline, having doctors on call to intervene as necessary. This is my final slide before the references page, which is the end. And really, public health emergency preparedness and response is critical. It is important. Before is the key word, planning ahead. And I just put some key points here. Being vigilant and planning. Unexpected events are unpredictable. FEMA, it's all about preparing, planning, and staying informed. Save the FEMA website and visit it regularly to stay in the know. And I said first responders deserve our respect and your attention. Michael, I hope this has been good for you today. Thank you so much, and I hope you and I will get to connect sometime soon. The next slide will be the references. This is the references page. I listed all where I got all my information from and the websites. I highly encourage you to visit it, play around with it, develop a plan, and be prepared. Thank you so much, and take care.